Welcome to my podcast. Today I'm going to talk about another case station. It's one of the most important case station in Lab 2, and it's that you need to try to cover it from all aspects. So I'm going to talk about only one of the methods in here, and it's regard men. So basically you introduce yourself and double check the patient name and date of birth as we always agreed. So in this situation, it could be a male who's coming to your clinic, or maybe he's coming with his partner and have some worries, some anxiety, and some concern that he needs to talk about it with you openly, and in an open dialogue in order to understand the whole situation, and then he can make the decision because the decision is quite big. So in that regard, the patient want to basically not have children anymore, and maybe he finished already his family. I mean, he has, for instance, 2 boys, 2 girls, or whatever, and he's happy so far, and he doesn't want any children anymore, and maybe his partner or his wife is not in a position to do the contraception, maybe health-wise or any other issue. So I'll just probe through different contraception, and then I'm going to talk about male contraception. So contraception can be in different forms and shapes, and it can be either physical or pills. So the common one that we all know is condoms, which is male condoms. However, there is something called female condoms, which is also a single-use, disposable barrier method, and it's worn inside the vagina, and it says that it's 95% effective if it's worn rightly. However, it's not ideal for any female who doesn't feel comfortable putting this thing in her private places. The other thing is pills, as we all know. So there is combined pills, there is progesterone-only pills, and each of them have their own pros and cons. I'm gonna probe in that in another podcast. The other method, which is common here in the UK as well, is contraceptive implant and contraceptive injection, and both of them can be used between 3 months to 3 years. That's in the implant, and injection is 12 weeks' time or 3 months' time. The other one is caps and diaphragm, which obviously can be used by a woman, and she needs to put it up in an upper part of the vagina to cover the cervix effectively, and it can be difficult sometimes and cause discomfort. So I will probe in that in another podcast. And the other thing is contraceptive patch, and there's, as we all know, intrauterine device or coils, an intrauterine system, hormonal coil, and each of them they have their own indication. I'll touch upon that in another podcast. And there's also the family planning method, which is fertility awareness, where they know they can use the counting method if the woman has a regular cycle, and she can predict or know or test for her ovulation time. So that could work for certain women as well. And obviously there is the vaginal ring. And the other 2 permanent ways, all the one I just stated, they are not permanent. And the other 2, which is permanent and well-known, that's female sterilization and male sterilization. So I'm going to talk about male sterilization in this podcast, just to understand what's the story about it. So the male, he will come to say, and I would like to know a lot of information about this. I have made my own search, I read about it, so I'm determined to have this. So you could ask, why would you like to do it? Is there any particular reason? Do you have any concern? You will hand a leaflet if you have. And then you will explain the situation to the patient, and you need to see the age of the patient as well, if he's, for instance, 30 and above or 30 and below, because each can have their own implication. So I'll explain. It's a quick, painless, effective surgical procedure. Can be conventional or the other ways, which is basically as it used to be before. It's a surgical cut at the bottom of the man's scrotum. whereby you will basically cut the vas difference, which is the tube which carry the sperm produced by the testis in the tube and ejaculate before the sexual act. Or it can be by the other method without any cut or any of that. It's about basically blocking or sealing the vas difference by heat. So it's like it's like diathermy. So it's basically the heat effect will cause blockage of the tube, and this will seal it, and therefore there is no any way for the sperm to pass through the vas difference and reach the final destination. It's a minor surgical procedure, can be done under local anesthesia, as I say, by numbing the scrotum from the bottom. And the patient will be fully aware. It takes usually between 10 to 15 minutes, and the patient can return home same day if there is no complication or any of the other things. It's, as I say, is very effective. It has been said it's 99% effective, permanent, so the patient needs to think carefully because the probability to reverse it is very little, and in most cases it's difficult and it's not reversible. So it's a big decision if the male is accepting him being later on as infertile, so he can go for it. If it's difficult, you need to talk and counsel him, the male, in order to understand, because it can be very emotional later on if he thought that he made a wrong decision, and it could affect his family life and his relationship in the future. Some of the common myths about this: some men, they might think that it might affect their sexual drive, their libido, or their erection, ejaculation. All of that won't be affected. The only thing that when the patient ejaculate, obviously the ejaculation will be normal, but without sperm, obviously. And this will take like a period of time from between 8 to 12 weeks post-operatively to be effective. So in that period of time, you need to use the barrier, like for instance, condom or counting, any of that. You need to tell the patient that the first week you should refrain from sex and from any sport activity, lifting heavy object, and the expected things around that area post-operatively, that you need to tell him that your ball might be swollen, maybe bruised, maybe due to hematoma, blood around the area, and it could be painful, or it could be lumpy due to sperm granuloma formation. In certain situations, they has found that the pain can be ongoing, so the patient might live with the pain as well. So that's a rare thing to be seen, so it's not a major thing. However, there is little risk of infection, and this procedure obviously won't protect them against sexual transmitted infection. So you need to tell them you always need to use a condom if you are falling in any of multiple partner, as the case sometimes with some men. So before the patient goes for this operation and decided, the GP needs to do counseling, and before agreeing and consenting and signing the forms, because, as I say, it's irreversible. And then you will tell him that have you counseled your partner or whatever you have in your life, because it's a big thing that if you don't want any more children, or if you have any children, it's not a legal agreement, but the partner might have the right, if she doesn't want children, for instance, or she agrees with his plan. It's free, it's available in the NSH, and it can be a lengthy waiting list, so if the patient doesn't want to pay for it, he can wait. However, some men, they might go privately and pay for it because they don't want the long wait. And if the patient decided at a later stage that he wants to reverse it, as I say, it's very difficult to reverse it, and it can't be done in the NSH. So he needs to try that and try his luck in the private, and it can be very costly. And if the male patient felt uncomfortable and the GP was a woman, he can request a male doctor because it's intimate area and he might feel embarrassed to talk about this personal issue. So you can offer him that he can speak to the same sex in regard. As I say, there isn't any complication after ejaculation. It just won't be having any sperm any further, but it can be bloody in the first few attempts, and that's normal, and there is nothing to worry about. Postoperatively, you need to give some tips for the patient, so you need to tell them that you need to wear tight-fitting underwear or this one, athletic support, and should be day and night. It's not only at night. For the first few days or weeks until the bruise and the swelling goes down. And this is the whole idea, is to support the scrotum and ease any dragging pain or swelling. And some men, they go for the habit that they don't wear underwear. You need to emphasize that underwear is very important to be worn the first few weeks for this condition. And the patient can go back to work, however, to avoid, as I say, anything which need physical activity, just to avoid the risk of complication and infection. And as I say, the first few weeks or the first 1 week, avoid, having any coital or any intercourse, and use condom up to 12 weeks in order for the sperm to stop passing through the passage and ejaculate in the ejaculation fluid. In order for the operation to be declared as a success, always to arrange for the patient to have a semen analysis post-operatively by 12 weeks. It can be 1 or 2 tests just to see that the semen is free from sperm, and in that condition you will tell him, go ahead now, you are safe and you wouldn't produce any sperm. And you need to emphasize as well, it's a big decision, and because some patients, they might say, okay, I want to put my sperm in a bank and use them at later stage for IVF or any of that. You need to tell them that it's not a guaranteed thing for your conception, and it can be quite hefty, so you have to think carefully and thoroughly and weigh things, the benefit and the risks, and then come up with a decision that you feel is applicable in your situation and your case. And always, of course, after covering all what I have stated, you need to ask about past medical history, the medication, if the patient is taking any medication, allergy, if there is no any allergy, family history, if any alignment, because certain condition might have issue with that, and the lifestyle of the patient. Some they are sporty, some they are very physically active, or they are smoker as well, or drinker. So all of that you need to bring because it's like a holistic approach. It's not only one way thing. And I see you on another podcast. Thank you.